online ordering system with Coloplast, and I find that really good. It's Coloplast Charter, but it just depends per different area. Again, postcode lottery sort of thing as to which service is better. Most of our area uses Coloplast Charter, so that's what I use, but I find them the best. Although we can't get stat locks and haven't been able to for months. Probably the best part of the year now. I really need some stat locks because I find them so useful. I have to use grip locks at the moment. They are crap. Rip my skin to shreds. Hi Gemma, how are you, lovely? No worries, Sarah. Hope you have an alright day, darling. Get some shopping done, my sweet. You got stat locks delivered? Oh, I'm jealous. Yeah, for some reason they're not available with Charter at the moment. They're just not on Coloplast Charter to order. They want you to change them daily. Are they single-use night bags? I guess then. Because you can get single-use night bags or you can get multiple-use. But if you're attaching to a leg bag, if you're doing that, then that'll be why. Fair enough. Are you attaching to your leg bag, your night bag? Because if you're changing bags all the time, that's actually more infection risk. So you should just attach it to your leg bag, yeah. Because obviously I've got this bag on, but this is on for 5 to 7 days, and that's the best way to do it. But obviously I don't. I only use night bags, so you get what I mean. Hi Jodie, how are you? Bestie? Do I know you, Jodie? Sorry, that sounds really rude, but I don't know you, love. Alright, I guess. Oh, that's okay, no worries, I was just really confused. I hope you're okay though, sweet. Did they, see, I've been told... No, you're fine, Jodie, no worries. I've been told to just use night bags now, but that's because obviously with my mobility, leg bags are quite hard and they also break down my skin. Being on my leg, they break down my skin, so... Because I can't feel it, that's just more of a risk. Yeah, onto the leg bag. The night bag onto the leg bag. But I just have my night bag attached directly onto my catheter because I don't use leg bags at all anymore. Unless I'm going out for the whole day and I'm not in my normal wheelchair. Like if I'm not in this chair and have nothing to cover my night bag with, then I will use a leg bag and then just put it under my trousers or over top of my trousers. I'll try and cover it, you know, especially if like obviously I do go to restaurants or cafes, sometimes, normally cafes, don't really go to restaurants because I can't eat, but do go to cafes. But obviously I'm not going to go to, but I'm not going to go to a cafe with my pee on show, if that makes sense. That doesn't feel right to do. It's from Online Home Store, darling. Hi Tracy, hi Hayley. I've got a few bits from there. I also got this pillow. This big one behind me. Oh, it is so cold. Online Home Store is good, especially for like bedding as well, I think. Hi Vic, afternoon, sweet. And that pillow was from there as well, this big long pillow. This pillow is the whole length of my sofa bed. Like, the whole back of the sofa bed, which is handy. Hey, Ivy. How's my day going? As okay as it can be, lovely, thank you. How are you? How's yours? I've just had my care reliever. Well, she left at 12:45 because she had 2 hours with me this morning, so we just really sat and chilled. Like, she didn't have much to do because she tidied up so well yesterday. While I was in hospital, she came in and tidied up for me, so. The Dover drainage bag. Oh, you use, use the meters, as in like the ones that count how much urine output, like the chambers for the urine output measurements, and then you have to empty them every 500 or whatever it is, because they use them in hospital mostly. I don't know what brand they are, but yeah, they get used. Like, what are they called? Urometers, yeah. Then in a big bag, yeah, you flip it and then it collects in the bag. So it has like the front bit of the segment at the front that attaches it, and then yeah, you tip it and it all goes into the bag. There's like but the plastic chamber is attached to the front. Is that the one? The Urometer ones. Hate them. Yeah. I know they are. It's Cam too, lovely, it's fine, it doesn't bother me. Yeah, I just don't like Urometers, because obviously mine goes on the back of the chair, and that's quite big and bulky. It goes on the back of my wheelchair because I've got like a little, like, just bit that goes around the back of my wheelchair, and that really annoys me, having the clattering and banging of the Urometers. And because it's plastic, they can also shatter. I've shattered one before when I fell on the floor in hospital. That was when I was mobile but fainted and fell and it shattered. That wasn't good. I don't know, love, it's just weird. Afternoon, Jazz, darling. Yeah. Yeah, they don't apparently, Kaz, you are so right. Sorry about that, K-Marie, but there was obviously a reason. Pushing the meds. It's not a mess, it's meds, darling. Oh, okay. But I shake it, depending on what medication it is. That was a effervescent medication, so it needed shaking. Other ones, if they are tablets that are dissolvable tablets, like orodispersible, then I shake it because it needs to get all of the bit of the medication through the syringe into my tube. So that's why, to make sure I get all of the dispersed medication into me. And that's what I've been told to do. To make sure I get the whole dosage of the med. So I don't do it with every medication, but most. And that one especially, because that was dissolved. That was an effervescent one, so they go all gritty in the syringe, just like some of the orodispersible meds, or the dispersible meds. Yeah, that's okay. Yeah, so a lot of my meds are dispersible rather than liquid, because they don't come in liquid. So that's why I end up doing that, just to make sure I get all of the bits of, all of like the grains of medication, you get what I mean? That sounds really weird, but yeah. They always tell me to. But yeah, Victoria is strange, darling. Like, so many people do it. It's bizarre. One of the nurses that I met in the intestinal failure clinic actually told me to do that. She watched me give my lunchtime meds when I was ready for an appointment at Adam Brooks in the intestinal failure clinic, and literally she we were on the gastro ward waiting for the clinic, and literally she just said, "Oh, I've got a little hack for you," and I was like, "Ah, thank you. Handy." So she said, "Do it that way because then you get the whole medication, the whole dose of the medication." Like, fair enough. Makes sense, to be fair. So the air in the syringe, I can't put air down my tube, lovely, and I don't. There is strange people on this app sometimes, lovely. So like in injections, it's not the same, but my meds go into my intestines, love. So this tube goes into my intestines, that's where the meds go. So you will not see me push air directly down the tube. Shannon, your question didn't come up, lovely. So it must have had a word in it that wasn't appropriate. Because it would have been filtered for a reason. I'm paralysed from my waist, but my waist, lovely. I'm paralysed from the waist down, technically, but I don't talk about that, and I don't need to talk about that. But yeah. But it's called paraplegia, which is paralysis of my lower body. When you've given them, what do you mean, Sarah, lovely? Hey, Jazz, darling, how are you? No, that's okay. I just don't really speak about it. I don't need to, love. I don't really speak about loads of medical stuff on here anymore because it's just not necessary. Plus also, like, not being funny, people give me hate and I don't deserve it. Exactly. It's not fair on me, lovely, but you still can't stop someone. I do, yeah. I'm NJ fed with an NG for drainage, lovely, so it's a bit different. So PEG isn't an option, and I've had a PEG J before, but yeah. Are you, Elaine? Fair enough. I'm not in Kings Lynn, though. I'm not sure about that, lovely, but yeah. So first of all, you're saying a location that I don't even know where it is. And second of all, does it matter? If you were a medical clinician or professional, would you really want to disclose your location anyway? Because technically you shouldn't be. So are you a neurologist, lovely? I am indeed, Nikki, thank you. I mean, I don't actually mute anyone, but yeah. I didn't say I was a doctor, lovely. I have doctors, I don't like, but yeah. I'm sorry, I didn't meet you though, lovely. I don't talk about that. And no, I can't because I can't have a peg. I'm not fed into a peg. I'm fed into my jejunum, which is, I'm not fed into an NG, I'm fed into my jejunum, so I would need a peg J, and I've had one before, so unfortunately it's not something I can have again, but yeah. And there's reasons behind that, but anyway. Yeah, I do, lovely. But I had a peg J in the past, so yeah. No, I'm not trying to create arguments, guys. That's just, we don't need arguments, sweets. Let's keep it nice and positive. We're all good. No, I understand. I wasn't being horrible to you, lovely. I wasn't trying to be anyway. Thank you, Isla. I was just trying to explain that I have had a peg J before, and yeah, it's not an option for me again, unfortunately. Oh, okay, yeah, I know you were. These are from Chubby Cheeks, but they were a while ago. That's okay. So yeah, Chubby Cheeks, but a while ago, lovely. She wasn't asking about herself, she was asking about me, Victoria. She was asking about my own conditions, not about anyone else's. So she can't ask her GP because it's about me. So that makes no sense, Victoria, sorry, but... This is a dressing gown, lovely. Yeah, I don't like them as much, but personally I don't anyway, but I found the quality isn't quite so good, but literally, like, there's some quite rude people on here at the moment and I don't know why, so guys, can we just chill it? I don't know. Is it? So no, I don't have a garden. Everyone needs to hulk. I don't, no, unfortunately not. I can't go on holiday, but I'm not abroad, and currently I'm not able to travel very far in the car either, so I'll just get these from Specsavers, so yeah. Because Specsavers do home visits, and that's just, yeah, because I'm housebound. That is the place that came out to me, and that is who done my prescription, and then they also sold me the glasses. It was just the easiest way. And it actually worked out alright with my NHS voucher. Although with the two pairs, they were quite good, although one pair is already broken, and that was only less than a year ago. That's my favourite one. I don't drink just any energy drinks, it's only Monster. But only that one is my favourite, or the peach one, but yeah. I've only had any pets before. When I lived with my parents, I had a dog. But yeah, I can't anymore. See, she's called Daisy. See, I don't drink energy drinks because it's an energy drink. I just drink because I like the flavour. But my actual favourite drink at the moment is Vimto Squash. I will just say Monster is bad for you, so I sound like a hypocrite, but it literally doesn't absorb into my body, which is why I can drink it, because otherwise I would not be allowed to drink it. So it's not the healthiest drink to be having, and if you haven't had one, I'm not recommending you start. I literally only have one because I like the flavour, that's literally it, and it doesn't absorb into me regardless, so it doesn't cause me any harm, but they can be quite harmful to people, so be careful what you're doing, guys. That's all I'm going to say. I sound like a complete hypocrite, but also mine doesn't absorb, so it's a bit different. Yeah, that's fair enough. Yeah, so I don't have any energy, but also, like, I don't absorb anything. Even milkshakes don't absorb, lovely. And the energy doesn't, I don't get any energy from it either. So milkshakes don't absorb, nothing absorbs into my stomach. So I can technically drink anything, but I only drink for flavour. My stomach doesn't work, that's why I'm fed. Yeah, so mine is also on drainage, so mine drains out. This tube is for drainage, but also, yeah. The tube is for drainage, so it drains out, but also doesn't absorb regardless. Do you? So it has no effect on me, but yeah. Probably, but I wouldn't touch it regardless because of my medication. I wouldn't ever touch it. I've never had a desire to touch it. I don't even think it tastes nice, so there'd be no point. I only drink for flavour, that's the main reason. That is the only reason, actually. Flavour and enjoyment, that's the only reason. So, alcohol, personally, I wouldn't touch. There'd be no point. So, no, it probably, and more than likely, would not get me drunk. There's very, very minimal chance it could ever, even with huge amounts, could it get me drunk. But I still wouldn't because of my medication, but also because it's vile. I've had one drink in my life and it was pointless and disgusting. I've been teetotal forever. I've only ever had one alcoholic drink in my whole life. Oh, bless you. And I'm 25, just for context, so yeah. And it was only something like a really like crappy like cocktail that was made with like a tiny bit of vodka. That was it. So yeah. I mean, mine doesn't mess with my head, but yeah. I just don't see the point in it regardless. No. But it wouldn't get me into trouble, this is the point, because it wouldn't do anything to me, but yeah. Oh, I could permanently do with a nap, honestly. Fair enough. I need to mix my feed up. I've had a dietitian appointment and she wants to start me on a feed, well, trial me on a feed for literally the next week and that's it. So I'm literally like, great. So I've got to mix it up, but I'm not allowed to be on it long term. So like, this is the worst thing. I don't know why she's even trialing me on it. She wants to see if we can get any of my gastro symptoms like lessened at all, but I don't even want to make it. I can't be on it long term because it's too low calorie. It's only a week, but she says even if we can do it a week out of however so long just to lower my symptoms so I get a bit of respite from it, like, but ugh. Which is nice of her, but still like, need to gotta mix up this powdery stuff. Yeah, apple user. Oh man, so... Does it, bless you? It's a feed, darling. That's what she said, yeah. Bless you. Are you in a manual wheelchair, darling? So I find it so hard, even though mine's a lightweight chair, I find it so hard to push myself far. Bye, love. Jesus Christ, that's made a mess. Yeah, bless you. Do you find it difficult? It does. It also dislocates my arm sometimes. Well, my shoulders, not my arms, but... might be, Hey Lily, how are you? Anyway, good luck, lovely. Have a nice time at the shop, I hope. Oh, fair enough. Not great, I was in hospital suite, but... is that a plane? That is a plane in the background noise, yeah. Okay, I'm as okay as I can be, yeah, thank you. So loud. Yeah, they fly really low down here, or around here anyway. Yeah, they are. They fly. So like I say, they fly really low around here, so they are louder because they're lower, obviously. Yeah, we're not that far from an air. Oh, jeez. I'll say from an airport. We are far from an airport, but like, when we're in reality, we're not that far, to be honest. Not for the plane, like flying wise. The flight path, yeah. How am I doing? Not too bad, love, I guess. Thank you. How are you? Yeah, they're hard. My hands are so red. Why did you put it on here? Hello. You're at uni, Mia. You have a lot of lectures and stuff you're doing. Do you mind me asking what you're doing at uni? Right, okay. No. No one's ever told me. I snore and I've had tubes for a long time, so no. Apparently not. Apparently I actually have very shallow breathing when I sleep. Very shallow. I make hardly any noise that and you can barely tell I'm breathing apparently. Which I find really weird, but yeah. Apparently I've scared quite a few people because of that. They have to like proper put their hand on my chest and think and like wonder if I'm actually breathing. Feel bad about that, but yeah. But that doesn't wake me up regardless. Mirror test, what? I'm confused, Jazz. Oh, I used to do that as well, apparently. I used to sleep with my eyes completely open, not half open, completely open. So I used to be able to sleep with my eyes open, which I find is very bad. Apparently I still do sometimes. Yeah. Apparently I still do. My carers have found me asleep with my eyes open. And obviously because they roll sometimes as well in a seizure. I don't know. But because obviously sometimes I have seizures and I also have nocturnal seizures, it's really bad, like. Oh, bless you. I find that's really bad. Like, so I have nocturnal seizures as well. So sometimes I actually scare people that when I'm falling asleep or when I'm actually asleep, people think like, yeah, I've never had dry eyes. But yeah, literally, apparently, like, they think I'm going into a seizure as I'm asleep, but like, while I'm asleep, they think I'm just going into a seizure, but I find that really weird. Like, I would have thought they could tell the difference, but then if it's literally like my eyes are rolling and I'm asleep, I find that really strange. If they're open, that is, they can see my eyes actively rolling in my head. I'm like, oh Jesus. It looks like a devil. Like something out the Purge, the Grudge, you know. A thing that, I don't know, scary. And yes, I am taking the pee out myself. Do your tubes hurt my nose? Not really. Sometimes it might leave a pressure sore a little bit on the inside of my nose here, but yeah. Well, yeah, this is what my carers say, because I shallow breathe. That's what scares them. So I have actually had unfortunately I have had a carer come in to me once, and this is when this company first started with me. And it's on the system, obviously, as a day text. Well, as an incident report, they call them. But, so all of them can look back and see the old incident reports. And someone had to give me CPR because I was found not breathing as she came into my house. Well, I was found very shallow breathing, barely breathing, with a really slow pulse and everything like that. So, like, I find that really bad. Do they? Yeah, so literally my carer has had to... My carer has had to actually do, like, full-on CPR on me because my breathing wasn't effective for my body, so it was classed as a respiratory arrest. So it was, yeah, proper terrified her. And obviously, she was on the phone to the ambulance. The ambulance came within however long, but I don't know. So, like, I literally turned them, like, scared them so much. That's really good. I didn't know that. I mean, I haven't been in a mental health ward for years. I haven't needed to be, so that's amazing. Is it all mental health wards? Or is it a new thing being rolled out, do you know? Oh, yeah, I understand that. Everywhere, wow. Never heard of that whatsoever. It is, yeah. It's also good I haven't been in for years. I've been discharged from services, I mean like outpatient services, for 6 years now. And that's outpatient, let alone inpatient. Like, that's been longer, but... Thank you. Okay, fair enough. Yeah, I was 19 when I was last in one, so... And I'm 26 this year! Oh, closer to 30 than 25, that's depressing. Closer to 30 than 20. Oh my lord, that's scary shite. April, darling. Closer to 30. He'll be 1 away. I'll be 4 away, babe. Yeah, so I was in EDUs as well. They're the places I had to go. No, it doesn't feel any different, I know. So yeah, I was in EDUs from the age of actually 11 was my first admission, but so I feel you, but oh, that's amazing. I guess 30s better than 20s. I hope my 30s are better than my 20s, to be fair. Oh, okay. Hope it goes well, darling. I'm in other sections, so like very different. So I can't give you the experience of self-referring, but yeah. Bless you. I'm as okay as I can be. And bless your daughter, I'm sorry. As okay as I can be, darling, yeah, like just I was absolutely knackered and had a lot of sleep. But Alice, I really hope they give you help, darling. You deserve it. It wasn't great, lovely. But it's better to do it, you know, willingly than to not do it willingly. Because when you don't do it willingly, you know, there's a lot more things they can do as well that isn't so nice. If you need to, darling, you need to. If, like, I don't mind you sharing that. Like, that's completely within your right to share if you want to. But I just really hope you get some help, sweetheart. You deserve it. If it's something you're comfortable sharing, you have. But I'm not going to take it any further. Like, I won't, you know. I'm not obviously going to say it to anyone else. What's said in here stays in here as far as I'm concerned, lovely. Send you so much love. See, all I'll say is it can become life-threatening quite quickly with them, so like it's better to get the help at the start if they give it to you rather than it go downhill, is all I can say. Because mine did become life-threatening, and I will tell you it's not a good position to be in. And that's when interventions are made that are patient's best interest, but also not good trauma-wise for the patient, if that makes sense. Creating trauma for people. So honestly, you're very brave, and I really wish you the best in it. Thank you, Gemma, darling. Bless you, darling. You've got this, sweetheart. Keep fighting. You've got this. If you ever want to chat, you can, you know. I normally use a tape, but yeah. I use an adhesive remover, a wipe for the tape, but I have ripped it off occasionally myself, so yeah. So I don't use spray. I use sprays for the ones on my tummy, but I use these normally. Oh, you're fine, Alice. So adhesive remover, I've got different ones of them, but I normally use the peel ones, but that was just some different ones I tried. But yeah, sometimes I rip it off, but I shouldn't because my skin is so fragile. Hi Rage, darling. How are you, sweetheart? Hi Apple user, how are you? Thank you. Lucas, okay, I need to check them, babe. That's a good point, because I was low earlier and I haven't heard it, or I haven't seen it go up, so let me just check. We're heading on the down. We're okay for now, but we're heading on the down. I'm really hot and sweaty as well. I will do, darling. Obviously, I've got my Libra, so let me just take this off because I'm really... Yeah, I'm not going to do it yet because I'm not quite low, but yeah. Like, we're not quite at the point I would treat, but we nearly are, to be fair. Oh, Jesus. I'm okay, yeah. How are you? Do a finger prick quickly, because I'm not convinced that reading's accurate. Yeah, I'll be alright, mate. Don't worry. Thank you. Sorry, I can't remember, babe. Where it is. Yeah, probably. I don't need to rest, lovely. My feed is on, lovely. My feed is on literally right now. Yeah, I can't rest regardless, mate, so, like, telling me to go rest isn't really, you know, yeah. It's not easy for me to just sleep, so I can't regardless. If you want to, babe. I don't mind. you want to request in, sweet? Can't find it. You have. It doesn't tell me you have, babe. Let me have a look. You haven't, babe. There we go. Hey, Jazz, sweet. Let me just change. Hang on, let me change you. I changed the layout, babe. I don't know what's going on.
Yeah, that's a bit weird, isn't it?
Oh, I don't understand this crap. Here we go.
There we go.
There we go, we can switch. Memphis.
His tongue. I feel weird being on a big screen.
Alright, babe. You can stay there. Oh, he's so sweet. Love him to pieces, Jazz. Can I have him?
He's a pain in the bum, honestly.
Oh, Steel. Steel's a puppy. Well, he's not a puppy, but... Your eyelashes, you've got a compliment on your eyelashes.
Oh, thank you, Madeline. I know. He's so cute. He just literally just sits there like... No, it's just starts staring at me and I'm just like, what do you want? I know, Nikki, he's got a sweet and innocent face, but definitely not in nature. Stop scratching. That's right, he keeps scratching his face and he keeps cutting his face with his claws.
Oh, he needs a claw trim.
Yeah, we do it like every single week, but he just...
What?
Yeah.
Jeez.
I know, right? Literally his head.
I'm literally dripping here. Oh, Lord. Bloody blood thinners, I tell you. Right, do you want me to set you back over, or do you want to come off? It's up to you. Do you want me to
Oh. See what I mean?
Yeah.
I'm coming. Come on then.
Do you want to go out?
Yeah. Oh, little house tour quick.
Gosh. Sounds like he wants to get you running, babe.
Literally.
Good luck.
Yeah, shut up, Helen. Go on then. Yeah, it was a loud bark, Nikki, honestly. He does it all the time. He barks at the telly, he barks at air, literally everything. You can swap us background, babe, if you want.
Huh?
You can swap us background if you want.
You. Oh, but will do. Hold it. There you go. Ah! Good job I wasn't on big screen for that anyway, because literally,
Oh
I
god.
dripped everywhere. You know what blood's like. Jesus.
Yeah.
I'm dripping.
Mm.
I read some good ones here. Did you miss the dog? You did. He's outside at the moment.
Yeah. I'll get him again when he comes back in. If he comes back in.
If you let him back in.
Yeah. He's currently sniffing a bush.
Lovely.
And now he's eating the bush. What are you doing? Yeah, I'm talking about you.
Oh, bless you.
Yeah, literally rage. Tasty. He even sits and chews on our rose bush and we're just like, what?
Gosh. Strange.
Yeah. He is so strange.
I mean, my nan's dog sits there and, like, eats the other one's stuff as it's coming out of his bum.
Yeah.
That's delightful.
It really is. Your pants. Have you not, Peggy? They're getting more popular now.
You know, so many farts that smell like roses. Oh, Jesus.
I can assure you, Rach, they do not smell like roses.
Love that.
Get out of the flower bed.
You're wrecking your flower bed.
Get out of the flower bed. Yeah, you. Come on. Good boy. Come here. Up. Come on. Come on. Up. Now you're going to sit there.
Show dog, like, on the podium, ready to show.
He is the star of the show now.
Yeah, literally.
He is your dad. He's called Memphis, Peggy. Please don't squeeze him, he might fart. And it does not smell like roses. I'll have to hang an air freshener on his tail.
Literally.
Were your sugars okay, babe?
Yeah, at the moment. Let me just go off and have a again.
Oi. He's literally a pain in my ass, honestly. But I love him. Oh, he's such a diva, honestly. He's now outside again.
Let's go outside, don't he?
Yeah. That's why I tried to leave the door open when it's not too cold outside, so that he can just come and go as he pleases.
As long as he can't escape.
No.
If any dog can, he'd probably find a way.
Yeah, literally.
Do I just let someone else in?
I don't know.
No, they're getting blocked anyway. But... tried to get themselves in, and I said, nope.